thank you all for being here. To our panelists, I will do a little introduction to each of you. We have Jennifer Vargo, who is an outpatient dietitian at St. Luke's Medical Center, and you help with the GI clinic and several other clinics as well, right?
Yes, that's right.
Wonderful. So we are so happy to have you here. Dr. Pereira is the IBD specialist at Advocate Aurora and also a member of our National Scientific Advisory Board since 2018 and on our chapter medical advisory board since 2008.
Hello.
Hi, Dr. Pereira. And Nicole Cherick is a psychotherapist and aorta counselor at Aurora Behavioral Health. So I should know. Yeah, thank you for being here. And you guys are all with Advocate Aurora, and the system is partnering with us to present this webinar today. And we are super excited to bring all of you together because we were talking about a little bit, patients may go to see Dr. Pereira, and then you may refer out to some of these other services, but a lot of our patients don't have the opportunity to have a discussion with all of you all at once. So we are super excited to provide that today.
Thank you.
Yes. And also, as we are taking questions today, I want to mention we cannot answer any personal medical questions or about specific treatments or medications. So if you do have a personal question, you're watching this, you can talk to your physicians and the people that you work with for your treatment. All right. Well, I think we can just jump right in. And the first question is for all of you. And it's fairly broad, but I'm interested to hear, how do IBD, diet, and behavioral health all intersect?
So as IBD physician, let me just kind of give the broad overview.
Please.
So when it comes to psychosocial stress, it does deviate the normal interaction between gut, brain, and microbiome. This results in the changes in the intestinal permeability and the immune response to different environmental events that can lead to actually flare of IBD. So the current literature suggests that it's the perceived stress actually seems to cause the IBD flare, not objective stress or the severity of the stress. So, and then when it comes to the diet, diet has two aspects to it. One is most of us has a very pro-inflammatory diet, Western diet, right? Which is low in fiber, high in sugars and fat, and other emulsifiers and additives, and you name it, you might eat it. So,
very true.
And then this changes the microbiome. In turn, the way our microbiome interact with the immune system changes, resulting most likely playing a role in development of IBD as well as flare up of IBD. So as for IBD physician, I know the importance of doing a multidisciplinary care using both behavioral health specialists as well as a dietitian, which will help us to improve the quality of life, not only quality of life, actually overall care of IBD patients.
Thank you, Dr. Pereira. That is so important. Jennifer, Nicole?
Yeah, I totally agree with Dr. Pereira. Exactly. Diet plays a big role, and I need a healthy digestive tract in order for the nutrition to be able to work. So these things all are very much so related. And from the mental health aspect too, I know that we eat for various reasons. And sometimes when we're feeling low in our mood, sometimes the thing that we might turn to make us feel better is going to be sugar. And sugar in particular may not be the best choice, and that might be making matters even worse in particular. But yeah, I mean, definitely all these things are very much so interconnected.
And from a behavioral health perspective and how they're all really connected is that we we can't separate our mind and our body. And so they're interconnected. And so our physical health and our emotional health, they're intertwined. And so being able to understand, how our chemistry and our biology affect our mood and our emotions and how we think, which then also leads to how we eat and exercise and take care of ourselves, that it's a combination of all those factors that play a major role in influencing and managing both our stress, our physical health, and managing a chronic illness.
Absolutely. And so, Jennifer, I just want to elaborate a little bit on this. I mean, the connection between IBD and diet. How does one impact the other?
Yeah, well, it does a lot. and thankfully here most recently, through the Crohn's Colitis Foundation, there was that major study that came out. And so it is available to everybody. If you go to the Crohn's Colitis Foundation website, and if you go to Diet, Nutrition, Research Updates, you'll be able to find that article right there, where they looked at the Mediterranean style diet and the specific carbohydrate diet, and they were able to show that there was symptom relief. This has been the first time, this is the first large scale randomized trial in the US showing that diet can significantly benefit adult patients with inflammatory bowel disease. So yes, there's definitely an impact. I also think about it just in the simplicity of the fact that we know that it's an inflammatory condition. And so right there with the Mediterranean diet, that in particular, the goal is to decrease sugar, decrease saturated fat, because those things can increase inflammation. And then by changing the diet, by getting, healthier fats in there, and by getting more fruits and vegetables and grains and sources of fiber, those things could potentially decrease inflammation. So I think it's really empowering to be able to know that, that is something that's within our control, something that we have to do on a daily basis, several times a day for that matter as well. And it's worth it to be thoughtful about the choices that we're making with our nutrition.
So let me ask you this sort of as a follow-up. I know that until this study came out, different people have different diets. How does that, how does that play into the decisions that patients are making and how they design an eating pattern for themselves?
Right. Because I think that's one of the difficulties with this. And I'm sure Dr. Pereira can, can add to this as well. The difficulty is that there isn't just one type of patient that this is exactly how it presents in everybody, and everybody is exactly the same. Unlike if I have somebody who has heart failure, I can go, okay, low sodium, watch your fluid intake, done. And I can pretty much, everybody can be exactly the same. With this, it presents so differently from person to person. So it does have to be very individualized. So there isn't going to be a one size fits all. We can't say Mediterranean diet, everybody, it does take personalization to be able to figure out what's going to be the best choice, and definitely important to be able to speak to your provider and or your dietitian to be able to find the best path as far as which diet is right.
Yeah, I totally agree with Jennifer. So, and one thing about the dying Crohn's disease study, so the take home is that we should increase the fruit and vegetables in our diet, but at the same time, it all depends on the individual. Because sometimes when you have, even you don't have IBD, there are the tendencies, there's intolerances that we all may have.
Right.
So that have to be taken into fact. And then it's how practical it is for you to restrict or change your diet if you have a young family. If you're a busy college student, how practical for you to make your meals every time. So I think it's learning the diet, that how it affects, and making good food choices regardless of where you are is the basis of making your nutritional changes. I think that learning to eat healthy, regardless where you get your food, is the sometimes it's easy to say than be done. And other thing about the diet, so diet, so the Dyne Crohn's disease study showed that there is improvement in abdominal pain, fatigue, sleep disturbances, even the less social isolation among these patients who participated in the clinical trial. But it may decrease the symptoms, it may even cause symptomatic remission, but there is no proof that it controls the inflammation.
Correct.
So it's extremely important that you conjunction your diet with your conventional prescribed therapy as is prescribed. Because
Yes.
diet is not going to take away the significant role that medication is going to play for the underlying.
Yes, agree, Dr. Pereira. Very, very important, because I know that I've visited with those patients as well, where, they're really hopeful that, maybe by making these changes to their diet alone, they could just be able to stop medications altogether. And agreed, when you do look at this study, there was, how do you say, like, there wasn't the histological, signs of remission. It was purely just symptom based. So it wasn't, doing a scope to be able to see that there was remission, but, respecting that an improvement to symptoms overall, from a healthy mentality, that's a good place to feel. That's a good thing to feel.
Oh, no, definitely. I think diet plays a significant role. We should always try to incorporate it in the treatment plans.
Yeah.
And Nicole, just to loop you into this as well, it just sounds a little stressful to have to monitor everything that you're eating and create a specific diet to manage symptoms. I mean, obviously the symptoms are a stressful factor as well, but I'm curious, if you hear from people, or if you can sort of give us some insight about managing the stress of managing a specific diet.
Well, I mean, it's certainly, yeah. I mean, again, it's like going back to that mind-body connection, right? Like, you just can't separate these things, and they're all just intertwined. And so I go back to, just taking a look at when you, especially when, when you're just newly diagnosed, it's all new to you. And you're just like hit with all of this information on top of your symptoms, which can be actually quite overwhelming and stressful, and very often leads to mental health symptoms like depression and anxiety, including things like adjustment disorder, and even post-traumatic stress disorder, right? So like, it can bring in like a whole lot of different psychological factors. And so what we do know from the research is that, right, like, diet alone and mental health alone isn't going to cure your symptoms, but we do know that if you don't take care of those things, it will exacerbate your physical symptoms. And so there's this heavy emphasis on really making sure that you're taking care of yourself, so that really I recommend for anyone that's diagnosed with any chronic illness, let alone IBD, because it's so complicated, right? Like, as Jennifer, you were alluding to earlier, it's different than someone with, a heart condition. There's just so many different varying factors. And I'm not to say like a heart condition is another thing that would have to cope with mental health. It's just different. So it's very individualized. And so when we take a look at being able to address all these things very early on in treatment, rather than waiting until you develop an actual diagnosis, then that preventative care can really help in all areas of functioning for you, which then will, help decrease the stress, and you'll be able to manage things better. But it really is like that interdisciplinary care and working with everyone involved. So it's really nice to see that we're having this panel, right? This emphasis on including different disciplines, involving them in treatment early on.
Yeah, I mean, I think just speaking to what you were saying, one of our recent studies found that 42% of IBD patients have some sort of mental health diagnosis. So being able to, get someone into behavioral health services as soon as they're seeing a GI, as soon as they're working through these complicated issues. I can see how that would, catching it early on would help ease the stress and everything that comes along with that.
Yeah,
So,
just like in expanding on that, Casey, though, it's not even just like something that would be a formal diagnosis, right? Like when someone's diagnosed with a chronic illness, there's also this tremendous amount of grief that happens, that occurs when you have a loss of life as you knew it, right? Like this was not in your plans. And so there's this grief about that as well. So it doesn't necessarily mean that it's a diagnosis, but do you see like how it can affect that as well?
Mhm,
My
mhm.
gosh, like I'm not able to do the things that I did before, and the sadness and the grief that's associated with that, or I'm not going to be able to do these things anymore.
Right. And
huge
especially, I mean, thinking about symptom wise, I know I was just visiting with somebody recently that unfortunately they were having loose stools, and it brought them to that point that they were afraid to leave the home to be able to go out and do things that they previously enjoyed, because out of fear of just not knowing, if they're going to have that urgency, will they make it to the bathroom in time? It can be traumatic, and yeah, absolutely life-changing.
So Dr. Pereira, when you start to see someone and you're maybe still in the early stages of navigating what symptoms they're experiencing, how do you loop in diet and nutrition and behavioral health to make sure that early on your patients are getting this holistic treatment?
Trying to educate the patient why they develop inflammatory bowel disease. So if you look at the pathophysiology of inflammatory bowel disease, so you have the genetic predisposition to develop the disease, but genes alone does not make you to manifest the disease. It's the environmental triggers, which includes the life stresses, as well as other environmental exposures, how it makes you to interact with your microbiome and your immune system. So that's kind of the perfect storm where patients will manifest. So when patients understand that it's not like a simple thing, okay, this is what just made me to develop this, and it's a complicated, complex interaction, as Nicole was saying, is the mind-body interaction we cannot really change. Like we cannot really separate those things. The brain-gut interaction is always there. You don't have to have a definitive diagnosis of GI disease disorder for you to manifest your stress as a GI symptom.
Sure.
If you are afraid of public speaking, you will have sometimes GI symptoms, palpitations, different things. So just like that. So, so it has to be done stepwise, because as Nicole was saying, it's a huge thing to just get the diagnosis for a young person who was otherwise healthy. Okay, now you have a chronic illness that needs regular treatment. We do have good treatment, but we don't have a cure. So that's a big thing, right? So when you have, and then for all my patients, I try to tell them how important it to at least meet with the behavioral health specialist and a dietitian. Not necessarily they are drastically going to change anything. Not necessarily they are going to get a label with a new diagnosis of the psychological illness, but just to learn how to just to deal with the diagnosis itself, to accept it, how to change your lifestyle because of the new diagnosis. And then in the clinic, I usually always ask questions about their diet, their weight, and the BMI. So that makes me to figure out how at risk they are for malnutrition. If they're low risk, I usually give them the resources through CCF. If they are moderate to high risk patients, I get them to see a dietitian. The same thing with the behavioral health specialist. I try to get them at least to see them once. And if they definitely have the screening suggesting that maybe they are developing anxiety, depression, those type of things, I somehow, most of the time patients are accepting. When you keep on approaching the same question every time you see them, you can get them to agree with that management plan.
So tapping into people like Jennifer and Nicole is part of your management plan with your patients then.
Yes, definitely.
That's great. So Jennifer and Nicole, there may be people who are watching this who don't go see Dr. Pereira, who may have other, doctors that maybe don't take that approach or haven't provided some of these resources. How can they tap into your specialties if someone's sitting at home watching this going, that's what I need. That sounds like something for me.
Cole, you want to go first?
Sure. So, well, it's really nice, like how my practice is, because Aurora has moved to incorporating mental health providers right within primary care clinics. So that part's really nice. So one, you'd want to check with not only you've got a specialist like Dr. Pereira, but even, early on in your symptoms with your your family doctor, and even asking if there's a provider in-house, because there's also people struggle with stigma related to seeking help for mental health symptoms, and it kind of reduces the stigma and having it right in-house, right in your practice clinic. You don't have to go to an outpatient clinic, but certainly those are other options. So anyone that is interested in accessing services with Aurora would call Aurora Behavioral Health and request services. But I think really one of the best places to start is with your family doctor. The other thing that I think that can't be understated, and I just find that this helps people so much, is that in addition to having professional services, there's also things like really connecting to the online community. People that share your symptoms, that are going through the same things you are, even like being a part of a Facebook group. I was sharing with the panel earlier that I personally had a diagnosis of ulcerative colitis. So I can speak to this on both a personal and professional level, like how much that was so helpful for me to connect with other people that struggled with what I did, and it would kind of normalize it. And I don't know, it makes it a lot easier. So, I mean, there is like tapping into your natural resources and then the professional resources.
Great.
Yeah, and from a nutritional aspect, it's fantastic if you're able to go to a clinic that might have a dietitian associated with it. I have to be honest in that sometimes it's difficult to get access to a dietitian because of insurance purposes. So, that might have to be the starting point for you, is to contact your insurance company and find out, does your insurance cover seeing a dietitian? And, perhaps this is a grassroots effort right now, maybe it's all of us being more vocal about the need and the importance of nutrition, and that everybody should be getting access to this. I know that there are some, insurance companies that are coming around and are recognizing that, but it is kind of slow going. And so that's why, it's nice, where I am working at the GI clinic and working with the providers there, because my services are always covered, and so that's beautiful. So everybody's got access to me, which is great. But again, on just purely an outpatient basis, for somebody to come and see me, sometimes, again, that hurdle is going to be the insurance. So definitely start there, and then just be very vocal so that they hear you and they know the importance, and can get you in there to be able to see somebody.
And we do have resources, and I will link to these to help people advocate for themselves through their insurance companies. And then Nicole, to what you were saying, support resources, we will also link to, we have support groups, and we have patient to patient, sort of like a pen pal program. And we have some great ways for people to navigate all of what you both were saying.
Yeah, I'd like to just expand just a little bit, and like in what therapy will actually help with is really, so it's working on just the adjustment of the diagnosis and how to cope with that, but also people that have chronic diseases have a higher rate of mental health diagnoses, including depression and anxiety, like I mentioned earlier. And so what happens with that is that the way that you think can also affect how you feel. And so doing cognitive behavioral therapy is one of the most common forms of treatment that's used in that, but also working on acceptance and commitment strategies, working on radically accepting the diagnosis, right? Like radical acceptance means that you're not happy or glad or, ecstatic that you have this diagnosis. It's just like, I am accepting this for what it is, and this is what my life is. And until I can accept that, then I won't be able to make the changes that I need to. So really working on those acceptance strategies, like Dr. Pereira mentioned earlier as well, and then being able to tie mindfulness-based stress reduction therapies into that. So there's hypnotherapy. I mean, there are lots of different strategies to use in therapy. So there's not just one. So, it's like finding a provider that you feel that you can establish a relationship with first, and then delve into where you need to go from there.
That's great. That's great information. So I feel like something that we've sort of danced around a couple times is something that we've been working on as a foundation. One of our efforts is called Treat to Target. And what that means is patients are able to have a conversation with their practitioners. They have a treatment goal in mind. It's the target, where they want to end up. And I think radical acceptance, to me, that's what made me think of it, is that, maybe that's the small step. Maybe that's the target for the moment, where, someone is still battling their symptoms, still battling inflammation. And then earlier we were talking about also, diet and behavioral health can help with symptoms. So maybe that's the target for someone, that they want to lessen their symptoms and then continue to treat their inflammation. And then obviously we, all of us want to see a cure and remission for all patients. And that's something also that Dr. Pereira, you can speak better to that. But I guess I'm just curious how each of you in your respective fields work with patients to establish those targets, and then to help people work on those treatment plans and empower them toward those treatment plans toward that target.
Yeah, so as IBD provider, what I will usually do, I try to find out what is the most important problem that patient has when they come to the clinic. Because that depending on where we are in their treatment plan, if it is a newly diagnosed, or is it somebody who has had the diagnosis for some time and failing therapy, having a flare. So each and everybody's target changes over time. So when we say treat to target, of course, our ultimate target is the mucosal healing. But to go there, we have to take baby steps, as you said. So it depends. It can be, I am going to be able to go to my graduation without being, so I think as a provider, the most important to have this open dialogue, the shared decision making, where we come up with a target. It doesn't have to be the mucosal healing, and then find out from the patient's aspect, okay, what do we need to achieve that target? And that incorporates most of the time behavioral health as well as dietitians help to achieve that target. As a physician, most of the time we can give the medications, but they have to have the mental status to actually continue with those medications and to maintain their nutrition, feel well. So that's exactly the interconnection between those three aspects of the care. I don't think we can really separate it, how important it is to do this multidisciplinary care for these patients.
Yeah, I'll just speak to, I'm sorry, do you want to go ahead?
No, go ahead.
Okay, so I don't think it matters like what discipline you're in, no matter what it is. You can only start with where the patient's at, right? And so I mean, really, that's where, coming in and doing a really thorough assessment. And that's where I was alluding to earlier, like making sure you have a good relationship with your provider, that you can speak to these things and be honest about the things how this is affecting your life. And so when we take a look at developing treatment goals related to behavioral health, it's certainly on, what are the areas of functioning that are being affected the most? And what would you like things to look like? At what point in your life did things look the way you wanted to, and how can we get back to that as much as possible? And I think so much of this becomes really just about meeting the person where they're at. And sometimes where they're at is not even, like Dr. Pereira said, like having a goal of graduation. For some people, it might be, what, I just want to get out of bed today. I'm just so exhausted that just getting out of bed is all I can muster. And if that's what you can muster, then that's progress, right? So you have to just start with where they're at and then just go from there and continually building on that. And really the way that treatment goes, whether you're, you're working on your diet or your physical symptoms or your behavioral health, it's not this continuous path. It's with flare-ups and life and stresses, it's this kind of roller coaster, and it's the radical acceptance, right? It's like learning that the roller coaster is going to come, and how am I going to manage it as best as I can?
Yeah, and your wording is exactly what I was going to say.
No, sorry.
It's so appropriate, because it just so shows how all of this is so interconnected. It's just that we don't all have perfect diets. But again, we know that there is a role for improving our nutrition and how that can help. But yeah, it's just that it's meeting people where they are, knowing where are we right now? How are you eating? How often are you eating? What are you hydrating with? Sometimes for me, when I'm working with people with nutrition in general, I feel like that's probably one of the best foundations for all of us is, how are you hydrating? Because hydration is one of the most important things before even food, for that matter. So for all of us, however that may look, are we doing a good job? What are we taking in to be able to get that hydration? And then, having the discussion and helping them to understand, when we talk about this Mediterranean diet or the specific carbohydrate diet or going gluten-free, trying to help people to understand, with making those changes, how can that affect them? And Dr. Pereira, you've talked about the microbiome a whole bunch, and that's so fantastic, because what an amazing thing, yet we still don't know so much about it, right? But from a nutritional standpoint, we know that variety is the spice of life. That's what's going to help it. So again, just having these conversations and explaining it, and just kind of putting those thoughts in people's heads so they can start to see, looking at their diet and hearing, what can have an impact, then they can be in control to start to determine, okay, well, based on what you've told me, I can start by changing this. And anytime that the person that I'm working with is the one that's the driving factor in making that change more magically happens. When I say this is what you must change, that's not going to fly. Nobody wants to be told what to do, right? So, I feel like that's part of my role. I feel like I'm sort of a nutritional guide in a sense. I'm there to explain, here's how we know nutrition can help you. Now let's talk together about how you feel you can take this information and move with it. So.
Great. I'm enjoying this perspective. I think this has been a great discussion, and I'm sort of at the end of my questions list, and I'm not seeing any coming through from our participants. So I'm wondering if you guys have anything else that you want to add, or if anyone who's on wants to send in a question. We're here. Is there anything else that I haven't asked you guys about that you feel like is important in this discussion, or any flags that went up while another provider was talking that you feel like you
Well,
could add
you
to?
know, and again, from the nutritional aspect, because we, you know, sometimes we're, you know, all you got to do is Google, you know, go on the internet and Google diet for IBD or what have you, Google the diet for low FODMAP, because we know that's out there too. Sometimes that can be a recipe for disaster, because without the guidance, sometimes that can turn into implementing a diet such as low FODMAP. I've run into this a lot, where sometimes people have looked at this on their own. They found the information, they start a low FODMAP diet, but they don't fully understand that that diet is a diet of an elimination, and you should only do it for a certain period of time. Then you got to challenge it to get you out of that so that we can reintroduce that variety, be able to get fiber back into the diet. I've seen people that will start that low FODMAP and be on it for months. I've even seen it up to like a year, and that's not the way that it's supposed to be done. It can be a very restrictive diet. And so then that, you know, mental health wise can be difficult, because then we've made it, we're now adhering to a very restrictive diet. So it's very important to be, you know, having these conversations about the diet, whether it's with the provider and or with the dietitian, because some of these diets are not to be taken lightly, you know, especially with this most recent research with the Mediterranean diet and the specific carbohydrate diet. A specific carbohydrate diet can be very complex. And it's not something that I would encourage, you know, our viewers to just go for it. Definitely you need to speak to somebody before doing something like that, because it is a major undertaking. But as we can see from the research, it's a worthy one, but definitely getting the guidance is absolutely necessary.
I think that's a good takeaway on all of this. We've talked about a lot of things and a lot of approaches, and it sounds like ultimately the first step is to talk to your, you know, your, whether it's your primary care or your GI doctor or whoever you're working with, to make sure that all of these pieces are moving together toward that target.
Right, right.
I'd say, you know, in some, you know, we're all saying the same thing. It is like the communication among the disciplines is so important for the patient as well, like being able to communicate and express your needs, because you're going to be having a lot of questions. And again, going back to that relationship. So from a behavioral health perspective, when you're looking into, you know, what kind of provider should I have, that you like, right, you know, Dr. Pereira, she's got her specialty, right? Like that's what she does. But when you look for a behavioral health provider, you also want to do some looking into what are their areas of expertise, what are their specialties, what are, you know, are they you know, are they skilled in working with people with chronic illnesses? Because not every provider does. So it's okay for you to do that research, because the relationship with your provider, no matter what kind of provider it is really the key to your wellness and the most important part of your recovery. If you can't communicate and express what your needs are, then you can see how that's going to complicate things even more. I mean, I just really emphasize the importance of doing your research on finding a provider that you think that's going to be a really good fit for you.
Wonderful. Well, you have all been such great resources, and we are so grateful for your time and your expertise, and for Advocate Aurora for joining us in this effort. I'm sure that people are interested in learning more, and for that, I will send out links to a bunch of stuff on our website. Our website is crohnscolitisfoundation.org. And then if each of you want to share where people can find you, you know, whether it's the internet or physically where you practice, they can share that.
Oh, were we going to do that live?
Yeah, sure.
Oh, okay. Well, you can, for behavioral health services, you can, in the Milwaukee metro area, you can call area code 414-546600 and just ask to get scheduled with a therapist. I work at Aurora in behavioral health in South Milwaukee, but you can call that main number and you can get connected to any provider.
Great.
you want to go ahead, Dr. Pereira?
Yeah, so I work, my main clinics are at Grafton and East Macquarie. So if you go to the Advocate Aurora website, you can find out where the exact location, and also you can call 262-329-8600, and you can connect with the schedulers if you need to find new GI physicians. I think the most important thing, as Nicole and the Jennifer was talking about, is finding a provider that you can easily communicate, you can easily relate to, where your needs are met. And so the open dialogue, the shared decision making, and taking the responsibility to for your own care is the most important thing for any patient who has chronic illness.
Agreed. And I'm based out of St. Luke's Medical Center in Milwaukee. Probably the best way to get access to a dietitian in general, I'll say, is reaching out to your provider so they could be able to put in that referral, and then just kind of going from there. Yeah, a team approach is always going to be the best way to go. Absolutely.
Wonderful. I think we've seen that in this discussion today. And again, we just really appreciate your time. And yes, we will be sending this out with all of those links, and hopefully we can do this again, because I think this was great information to share. So with that, I will say thank you and have a wonderful day, everyone.
All right. Thank you.
Thank you very much, Casey. Thank you. Bye.
Thank you. Bye-bye.
Bye.